All right, let's continue with your news at this particular moment. The department is today with the global community observing Universal Health Coverage Day. Now, the campaign aims to accelerate efforts by governments to implement UHC to ensure that everyone has access to quality healthcare services without facing financial hardship. Now, the global campaign is under the World Health Organization in collaboration with the World Bank and Organization for Economic Cooperation as well as Development. Well, to further unpack this, we're very pleased to have roped in the Minister of Health, Dr. Motsoaledi, to engage us on this matter. Minister, it's such an honor. Thank you so much for your time and happy festive season. Firstly, I see your department is not on holiday mode just yet. Tell us about today's campaign to implement universal health coverage.
Thank you, Alicia. Good afternoon to the listeners and viewers. Thank you very much for having us. There's actually no holiday in the Department of Health. I'm sure you'll be aware that even on Christmas Day, you are going to see various MECs visiting hospitals to welcome and see if everything went well with babies who were born on Christmas. Same thing as on New Year. So there's basically no time to rest, but you also know that on the roads, there are going to be problems when people start moving, and we are supposed to solve many of those problems. So today, yes, we're observing International Universal Health Coverage Day. It is a global phenomenon to make sure that people understand that the world needs to move in the direction of universal health coverage if we are to defeat healthcare problems around the world.
Minister, in terms of South Africa's path to UHC, right, we know that it's largely centered around the national health insurance, right? But talk to us about the current mechanisms currently in place or moving pieces to at least try and phase in and implement some of the policies in this regard. How are those efforts currently going?
Yes, universal health coverage, as you defined it, means everybody, and everybody means every human being on this planet Earth has got a right to access to good quality health care. And when they request that access, they must not fall into financial hardships or what the World Health Organization call catastrophic healthcare expenditure, where people fall into poverty because somebody got ill at home. Now, each country implement it in their own peculiar way, and it's given different names. In South Africa, we call it NHI. You are aware that the most well-known universal health coverage in our country is the British NHS, National Health Service, which was implemented in 1948. From there, we have got many other countries that has also implemented, but ours is NHI. And you are aware that unlike other countries, we are unlucky because we've been taken to court. There's no country in the world, to my knowledge, which was taken to court for implementing universal health coverage. What has happened is that maybe doctors threatened to go away, they threatened no longer to work for such a government. All those were threats. They happened in the UK in 1948. They happen everywhere, but I believe we're the only ones who have been taken to court.
And Minister, I mean, let's further explore the key principles, right, of South Africa's UHC, where there is a fundamental need for equity and funds, which we know have since been a huge concern since the US halted some of its funding to South Africa. There's indiscriminate accessibility and integrated systems also to consider. So how will all these then, in essence, translate into actual benefits for patients as well as users right across the country?
Actually, Alicia, if we have implemented NHI, we won't be bothering about what the US is doing. We wouldn't be, because South Africa, or let me start here, in terms of universal health coverage, the World Health Organization has recommended that countries must spend at least 5% of their GDP on health. And I'm not talking here about the budget. It's not saying countries must budget 5% of their GDP. They say they must spend. That means the total expenditure of health must be at least 5% of the gross domestic product of that country. Now, in South Africa, we have long passed that 5%. We are at 8.5% of the GDP on health, which means we should be far, far advanced than many countries, taking into consideration that European countries on average are at 9.5 to 10%, which means we're not far from them. So what is our problem? Our problem is gross inequality. That is happening in South Africa, and it's not happening in any other country. I'm sure all of you are in agreement that South Africa is the most unequal country in the whole world. Now, I'm inviting you, if you want to see that gross inequality, what do we mean by saying South Africa is the most unequal society? There's no place it manifests itself than in the healthcare system, whereby 14% of the population enjoys the best healthcare system you can get anywhere, and 86% of the population have to struggle. That's where our problem is, because the total healthcare expenditure of 8.5% of the GDP is a lot of money. But the problem is that in South Africa, 51% of that money is spent by only 14% of the population. And the remaining and whooping 86% of the population have to share the 49% of the total expenditure. That is where our problem is. And in NHI, we wanted to write that problem. And I'm repeating, if we have already done that, we wouldn't bother about Donald Trump. We definitely wouldn't.
Absolutely, Minister. Thank you so much for engaging with us at this particular stage on this very topical issue. That is the Minister of Health himself, Dr. Motsoaledi, live with us, unpacking, of course, the department's continued efforts to root out universal health coverage on this day of the global campaign.